And there is an ongoing MMRC study that's looking at that with patients getting 4 cycles of IRD consolidation after transplant and then randomized to ixazomib versus lenalidomide maintenance. And I think that might shed some light on this particular issue because, and I don't know if we'll be behind the times by the time we get the data, but as of now, a lot of these patients are getting multiple novel agents, and so it'll be pertinent to this time. I don't know how far the data will be.
So one thing that I would like to bring up in this context is that now, as we are moving into the future with more sensitive testing, we talk about MRD testing with flow and sequencing. We at our institution have both those in real time at the institution. We're also trying to develop blood-based testing. I think that the field is going to transform. Once we have the blood-based testings, I think there will be very many new maintenance studies where you basically can show that you maintain MRD negativity. That, I think, could be a new segue to development of new maintenance therapies. And that could be even subcutaneous shots of daratumumab or other drugs in the future. I think the field is going to just explode in this direction, in my opinion.
Yeah, that's good for our patients who can have more options. One last thing I just want to point out is that there are some ongoing trials about, well, how long of maintenance, because there have been differences about, where you get your maintenance and how long you get it for. And I know the Spanish are looking at taking people who are in MRD negativity and then randomizing them to continue maintenance or not. And I think that's going to be important from a resource utilization standpoint, because if you don't have to keep these patients on maintenance forever, it would be nice to be able to take them off.
And to that point, it would be, if you're going to do a test, do something with the results.
Yes.
So if you're
I would
MRD
love to use
positive
it.
or negative,
Yes.
we're not doing anything with the
Yeah.
results. So this is the first study, I think, that'll be acting on the results, which will be really
Which
exciting.
I think would be great.
And I think the blood-based test will just contincontinue to kind of
Absolutely.
deliver.
Yes. I mean, if we could do it on blood, I would just be so happy. I think the patients would too.
It'll be like moving from immunoglobulins to an M spike.
Yes.
We'll be moving from the suspected CR to blood-negative MRD.
Right, we'll just do an eye scan at the end. Yeah. Great. Well, this was a really great discussion about maintenance, and I hope that this was beneficial to everybody out there. I think we've talked about how there is data to show that maintenance can improve progression-free survival in various studies, and if you combine that all together, you can get a showing of how it's improved overall survival, although it's important to look at the details of each of these studies. There are other options for maintenance for people based on tolerance and potentially on cytogenetic risk. These are being explored in current clinical trials, and ultimately the length of maintenance may be defined by more sensitive techniques of disease detection like MRD, maybe even in the blood.